My name is Elise Byrne. I'm the director of the Northern Michigan University Center for Rural Health. Tonight's program has been organized in partnership with Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. Also this evening, I'd like to mention that tonight's program is being sponsored by Delta County and UP Communities That Care. So we'd like to thank them for that tonight. Tonight's program is going to talk about vaping primarily and may touch a little bit on smoking as well. And I would like to welcome this evening's panelists who will be joining me here. So tonight we have Sawyer Riedfeld. He is a prevention specialist at Great Lakes Recovery Center and also works with Communities That Care. Thank you, Sawyer.
Thanks for having me.
We also have Ashley Gleason joining us tonight. She is the health educator and prevention specialist at Marquette County Health Department. Nice to have you joining us tonight, Ashley.
Thanks, Elise.
We also have Stephanie McKenzie, who's coming from the Copper Country tonight to join us. She is a physician assistant in Houghton at Upper Great Lakes Family Health. Thanks, Stephanie.
My pleasure. Thanks for having me.
And lastly, we have Karen Brown. She is a tobacco dependence treatment coordinator at Tobacco Prevention and Control Unit for the Michigan Department of Health and Human Services. Thanks for joining us, Karen.
Hi, thanks for having me.
So usually we go over a lot of statistics right away. I'm just going to brush on a couple things tonight before we get started because all of our panelists have some statistics that they'll be sharing with you independently. So first I want to start by just mentioning that e-cigarettes were first introduced to the United States in 2007. So in some respects, they really haven't been around that long for us to be able to really determine long-term effects right now from vaping. The CDC study found that 99% of e-cigarettes sold in venues in the US contain nicotine, and that e-cigarettes can contain other harmful substances besides nicotine. Our panelists will be sharing a lot of the statistics tonight and how that relates to the topic for this evening. And we're going to start tonight with Sawyer. He's going to talk a little bit about vaping prevention and efforts that are taking place in Delta County, as well as a few other counties. And he'll talk about a few of the programs and what really motivates youth right now to try to quit smoking. So thank you for joining us, Sawyer.
Yeah, thank you again. I wanted to start off by kind of showing what trends we're seeing with vaping. Every 2 years, Delta County Communities That Care and all the communities that care throughout the UP have a youth assessment survey. And with that survey, it kind of determines where youth are at with their potential youth when it comes to vaping and other drugs. But with vaping in Dickinson County, we saw that about 30% have ever used in 2020. But in 2022, when we did the survey again, it went down to 20%. And that's ever used. When we look at our 30-day use, though, we see that it was about 18% in 2020. And now we're seeing it about 12% within students in Dickinson County. And in Delta County, it's a little bit different. We see about 20% within Delta County that has ever used, while we see about 15% that have used in the 30-day period. And that was statistics in 2021. Why this is important is that our national average is about 36%, which is below our average for people in the UP, which is great news. Obviously, we strive to do better every single day, but those numbers are showing to be below that national average. And that shows with this decline that there's more information coming out about what vaping is. We were told in general that vaping's a lot safer than smoking cigarettes. And so people started utilizing that as a way to either quit smoking, uh, but to find out that there were other harmful side effects. Uh, you mentioned nicotine as one of those, as a super addictive drug. And with that, it takes about 5 to 10 seconds for our brain to react to when we hit uh, our smokes. So when we get that reaction, it's pretty instantaneous. So we feel that nice uh, high in some way, right? And it becomes addictive really quickly. With that, kids become dependent really quickly. They find it difficult to quit, even if they want to quit. And so, whenever we do our programming, I understand that quitting could be difficult, but how, because each individual is completely different, we determine how each kid motivates them to possibly quit. And it's not like we're sitting there being like, hey, you have to quit by the next week, right? Is that what they're wanting to do? Possibly not. So we we have plans in place to be able to provide steps for them to potentially quit over time. And that's ultimately our goal as prevention workers, is to give them tools and resources to, and over time, potentially quit when they feel like it's time for them to. And so that's what we do as prevention workers. It's not that we force them to quit right away. It's that we're giving them tools and resources for them to uh, build resiliency and to uh, give them hope that they'll quit in the future. And I guess I'll mention a few of the programs that we specifically do. One of them being Catch My Breath. Catch My Breath is a resource that we have been utilizing for the past couple years. And we utilize those in every school free of charge within the counties that are able to uh, provide it. That it's free for, it doesn't have to be a prevention worker either. It's free for schools to individually promote this program. And it's about 4 weeks. It talks about what's in vapes. So we would see like propylene glycol, vegetable glycerin, leads, tins, right? So all these other harmful chemicals besides our nicotine are in these products. And so we talk about that. We talk about the vape companies who target those individuals to use, a lot of them being our flavorings that we see in the vapes uh, that we have in our products. One of the other ones that we utilize a lot is called Prime for Life. And Prime for Life is one that we utilize if a youth gets caught with a vape. So these are a more intensive program that oftentimes gets utilized in a in like drug courts or probation officers. And so we get referred to these youth to be like, hey, what's that potential for you to quit? And it's like 12 hours of their time to get to listen to us talk about what are these harms? What are you wanting to see in 5 years? It's not just about vaping. It's about what do you want to see within your 5 years? And so that's one of those major aha moments to like sit down and talk about those steps that they want to see. Are you wanting to become dependent after 1 year? And that's where most people tend to think, do I want to? Normally, I would be able to say, I'm going to quit today. After 1 year, it's a lot more difficult to do that. You become super dependent on that. But those are a few of the programs that I have been utilizing and other communities throughout the UP have been utilizing to try and combat this vaping.
Thanks, Sawyer. You know, it makes me think we should back up for a minute. It makes me think about when cigarettes were the only thing around. It was pretty obvious when people were smoking cigarettes. You couldn't really hide. Every cigarette looked alike. Vaping has been a whole different ballgame. Vaping comes in all different kind of shapes and sizes. And, can you talk a little bit about for parents who maybe only grew up with cigarettes around, what does vaping actually look like these days? How do you identify some of that vaping material?
Yeah, so that's always a question that we get where it does come in different sizes. Oftentimes, when we look at Juul, which is a major product within the country, we would say it looks like a USB stick that you would normally plug into your computer. But now we're getting them where they're a little bit thicker or that they're longer. Some of them can be box mods, so they're super bulky. And so they all come in different sizes. Oftentimes, when you see them, there's a label on the top and it's pretty bold so that you can pretty much distinguish what it will look like. So it depends on the brand as well. So it's super difficult to determine, oh, is this a vape? Oftentimes it has a slot on the top, a light on the bottom, and it's pretty normal to see it in that sense.
And I think that's really important for people who don't vape, who may be parents or teachers that don't know what to look for and just may, misconstrue something that they see. I also think, I think in 2019, the legal age to be able to vape had changed as well. And so
Yeah.
I believe that's 21 now, right? So you should be 21 to be able to vape.
Yep, it's 21 to be able to vape now, which it has been going well, I think.
What have you seen in schools, Sawyer? Because you've worked a lot with the school systems, and I know you've talked with superintendents down in your area. And I guess what kind of perspective do they have on this?
So every time I bring up the conversation about vapes, they show me their drawer. They open up a drawer and it's stacked with vapes. And they go, what are we supposed to do? And I go, well, first of all, let's start this program and see what the kids' reactions are about it. See how engaged they are in it. And then open up that discussion with the kids. Do you think this is what was in it to begin with? Oftentimes when we first started this conversation that, oh, it's just water vapor. Actually, it's all these chemicals, nicotine, propylene glycol, vegetable glycogen. We didn't realize that it wasn't just water vapor coming out. And so it's like a shock value in some ways. And so when the principals or the superintendents come to me, they're like, how can we acknowledge that this is happening? And it is happening throughout the whole UP, but also give grace to those kids in some way. And each school is different. We've had a school with a policy that specifically said that knowingly possesses vape. Well, that knowingly part is super important. If they said, oh, I did not know that was in there, they can't get in trouble. But when it was a different school, they're reporting it to police, or they're having it so that the police handle those incidences. And I don't know which way is the best route to go, but I think policy change is definitely the answer when it comes to in school to kind of shore up some of those loopholes.
Great. Can you tell us, Sawyer, what's the best place for people to go if they want to learn more information about CTC or even the programs that you brought up?
Absolutely. So the CTCs are all under the UPCTC. And so you can, if you're wanting to engage in our coalition, you can go to upctc.com and it will have every county in the UP that has our coalition. And so, and they'll have each coordinator there that you can get in contact with. And each coordinator will have data specific to your county, which is really exciting as I don't have all the answers for each county. But we have some amazing professionals. I think we're up to 8 professionals in prevention that are coordinators that run our communities that care, which has increased in the past.
Great. Thank you, Sawyer. Appreciate it. And I just want to thank you again for also sponsoring tonight's program. So
Thank you.
if you're just joining us, this is the UP Community Health Town Hall program, and tonight's episode is primarily focusing on vaping. Our next guest is Ashley Gleason. She is a health educator and prevention specialist at Marquette County Health Department. Ashley's going to be talking a little bit about preventative programming in the school districts within Marquette County. She's also going to talk a bit about attitudes around nicotine and substance use and what's taking place at the local level. Thank you, Ashley, for joining us.
Thanks, Elise. I appreciate you guys having me this evening. I'm going to be focusing a lot on different youth attitudes surrounding vaping and kind of just circling back and echoing a lot of what Sawyer had already mentioned, what we're doing in CTC surrounding youth and what we're doing to prevent vaping. So youth attitudes are changing regarding nicotine use overall, and unfortunately, it's not always for the better. We've been smoking and we've been studying smoking for around 7,000 years, and we know that smoking causes cancer. Our children know that too. They know that smoking causes cancer. Vaping, however, as we mentioned before, they kind of lack those really essential long-term studies that adolescents thrive on and that ultimately kind of prevent the use or starting to use of nicotine. Unfortunately, the overarching attitude surrounding vaping is that it's no big deal. I hear it's no big deal. It's just water vapor. And I hear a lot that it's a safe alternative to cigarettes. Our Marquette County Cares Coalition performs a biennial youth survey where we actually measure those youth attitudes surrounding substance use, along with numerous other risk and protective factors right here in our community. Now, this is really special because we aren't just looking at state data. It's our kids and it's in our community. So it's very different from a lot of the surveys that we're used to looking at in prevention science, where it's this state survey with the kids from all over the place. So we know that children in Detroit are going to have different risk and protective factors than children that are hanging out with us in Marquette, Michigan, or in other communities, or in the UP in general. It's just a different environment. We're a rural community with different needs. So we're making sure that we're taking a peek at that data in our community and assessing what programming we can use that surround and address some of those risk factors that we're seeing, especially in regards to vaping. Now, we just ran the survey again in 2023, and we are just diving into the data that we have received from that. But I can tell you that vaping rates, unfortunately, are up, especially in our younger populations. So we're looking at our 6th graders around 11 or 12 years of age. Also, the use of stimulants like caffeine have really skyrocketed amongst all age groups. So we measured 6th through 12th grade, and caffeine on all accounts has really just gone way up, or the use of stimulants in general. This is really where our parental involvement is going to come in. It's up to us as parents to really have those clear lines of communication and making sure that our expectations on what we want from our children or what we expect surrounding vaping and nicotine use in general, that's where that's going to come in. We really want to, tough conversations with adolescents, they're not easy. And we just want to make sure that you keep talking, even if it looks like they're not listening, even if you're getting the eye roll, even if they know everything at that age. I promise you, keep talking, they're listening. And if you're still panicking as a parent about vaping, don't. Even if your kids aren't coming home and saying, Mom, I learned about vaping today, or Mom, there's prevention programming in my school. I promise you, it's absolutely happening right here in our community and in the communities all around the Upper Peninsula. And this isn't your 90s DARE programming. So we really are delivering the very best for our kids in prevention science these days. Our Botman's Life Skills Training Education, it's based on more than 40 years of peer-reviewed scientific research, and it now holds the distinction of being the top evidence-based substance abuse prevention programming in the country. So we are giving the absolute gold standard, the very best for our kids right here in our communities. Life skills training also has the highest return on investments of all substance abuse prevention programs that have been studied. So this is because we're going well beyond that just say no prevention framework. We're finally tackling real topics, social emotional skills that provide that natural framework that helps our kids resist substance abuse. We're teaching adolescents to not only just make healthier choices, but how they can have those coping mechanisms that really help them combat anxiety, depression, and other big emotions that would kind of be where we would start when we look at that experimentation phase with substances. So we can kind of put all those skills in their backpack by the time that they need to use them when substances might be starting to get introduced. They can just walk right into that thing knowing that they've got those skills on hand. So we're really making sure that we can do that with our kids. A couple awesome stats that I love out of the Botvin's Life Skills Education Program is that we're looking at cutting tobacco use by a whopping 87%. This is having measurable long-term impact. Alcohol use by 60%, marijuana by 75%, and kind of poly drug use by 66% overall. So that's the combination of other substances being used. We're also seeing reductions in violence, reductions in risky behavior, and just overall those effects are lasting long after the Botvin's Life Skills Education Program has been implemented in our schools and is over. So we're seeing our kids go into adulthood already armed and dangerous, making awesome decisions. Now, our community is amazing. They truly want to see our children succeed, and upstream prevention, which is what we all like to do, is all about how we can have that, collective impact before we need to intervene, before intervention. And almost every county in the UP now has a Communities That Care coalition. So you can absolutely get involved on numerous different levels, whether you're a parent, a school administrator, a teacher, or just a community member. You really have the ability to put youth success first, especially when it comes to vaping prevention and education, and have a healthier future for our teens. We get this, and we're hard at work keeping these prevention programs in our schools, in front of our kids, where it matters the most. We really want to make sure that at the end of the day, our goal is to support and provide young people with opportunities, skills, and recognitions that really strengthen their bonds with school and their community. And we know that strong bonds means healthy kids, and that's kind of what we want to see in prevention programming.
It really surprises me when you say 10 and 11-year-olds and you think that the legal age is 21. Like, that's amazing to me that children that young, are attempting.
Yes. So that's why it's so important to measure risk and protective factors in our individual communities. We want to know at what age are we starting to see increases in experimentation? At what age are we starting to deliver prevention programming? And at what time are we making sure that we can have a measurable impact for them?
Yeah. Another question I have is, you think about cigarette smoking, and you can tell somebody who's a smoker by the smell on their clothes and everything. Does vaping have that same impact? Can you tell when somebody's been vaping based on like the smell of smoke, like you would if it were a cigarette?
Unfortunately not. So our vaping clouds, it's not just water vapor, right? So we're always making sure that we're educating that it is absolutely not a safe alternative to cigarettes, and it's not just water vapor, and it's going to have a distinct odor. Most of the time, those fruity flavors are directly marketed to our teen audiences. There's going to be flavors like strawberry cupcake and blueberry, and it's going to have that strong fruity smell. So you're just going to walk into the bathroom and smell that something fruity has been in the air. Or if we've been in a public location and we smell it, you can definitely tell that it's not the same as cigarette smoke. That doesn't mean it's safer than cigarette smoke, but it definitely is going to have a different odor to it, which unfortunately is very desirable and marketable to our younger populations.
I went into a gas station the other day, and I never look around. Usually I just go up, pay for the gas, and leave. And I had to stand in line for a moment, and I looked up and I saw it was like 15 to 20 flavors. And at first I thought, oh, I didn't know they sell ice cream, and these were all the vaping flavors that they had available. And I was kind of surprised, really surprised by that. And I know that we're going to talk a little bit about what's up in legislation when it comes to some of those flavors when we get into Karen's talk. Ashley, I wanted to ask you, what kind of advice do you have for parents who might want to discuss vaping with their child?
Having a clear expectation or clear lines of communication as a parent is going to be really important. Making sure that your kids can come to you with questions and that they understand your expectations on vaping or how you feel about substance use in general. Our kids are forming their attitudes surrounding substance use based on how their parents view substance abuse and substance use. So if it's generally acceptable in your home, it typically is going to be generally accepted by your children. So you really want to make sure that you are letting them know that it's not a safe alternative to cigarettes. And if that's something that you don't want them to be using, that they understand that. Also to make sure, again, that those lines of communication are open and that we're providing that framework for our kids to come to us with questions.
Yeah. Can you talk a little bit about intervention efforts taking place in Marquette County?
Absolutely. So every single vendor in Marquette County, which is very exclusive to Marquette County, actually needs to have a tobacco retailer license in order to distribute or sell tobacco products to anybody. So part of having that license means that you not only need to pay a fee to the Marquette County Health Department to have that license, but you also need to have more of a vested interest in making sure that you're not selling tobacco to minors. We do random compliance checks every single summer. We send volunteers aged 19 to 20 in there. We have them try to buy a tobacco product or a vape product, and it's up to your staff members to have the responsibility to card and deny that sale. So we make sure that we're keeping measurable data and tracking that. We're providing targeted education to our tobacco retailers, and then we're making sure, again, that those retailers have just that extra layer of protection and that extra layer of making sure that they are doing their part to reduce youth access to these vape products or tobacco products in general in our community.
Well, thank you for what you do, Ashley. I think this education that's being made available, and everything from the school programming to encouraging parents to get involved with those communities that care. I think that's great. Is there any particular way that parents can get more involved in the CTCs?
Yes, so almost every community now has a communities that care, and we didn't invent this model. This is a science-backed prevention framework, and it's fantastic for any member of our community. We're super active on Facebook. If you want to check out UPCTC, your individual coalition in your individual area is going to have a way to contact them. So that would be my biggest way to do it, is hop on Facebook and check us out and get involved with your local CTC.
Yeah, and grab another parent, take a friend. The more they get involved in these programs, the more impact that it's really going to have. So thank you for promoting those programs, and thank you for what you do.
Thanks, Elise.
Next up, we have Stephanie McKenzie. Stephanie is a physician assistant at Upper Great Lakes Family Health in the Houghton Clinic. She's going to talk a little bit about the physical impacts that smoking has on our bodies. She'll also talk about some of the lung cancer screening recommendations, and she has a patient success story to share with us as well. So welcome, Stephanie.
Good evening. Thanks for having me. Like Lee said, my name is Stephanie McKenzie. I'm a physician assistant at Upper Great Lakes Family Health Center in Houghton, which is located directly on the campus of Michigan Tech University. I have worked in primary care for about 6 years now. My patient population generally ranges from teenagers to elderly adults, and I see a lot of college students given my clinic's location on a college campus. So the time that I'm speaking today, I would like to touch on the impact cigarette smoke has on the overall health of a person and the health of the people that spend time around those who smoke cigarettes. A lot of research has been focused on the dangers of smoking cigarettes specifically, and there's just not as much data at this point available on the impact of cigars, pipes, and e-cigarettes. Although a lot more research is being put into e-cigarettes because of its recent rise in popularity. I will touch briefly on therapeutic options for quitting smoking, screening for lung cancer. And then I want to discuss e-cigarette use as well, because I do see a lot more people starting to engage in that activity, especially our younger people. So our goal in primary care is to prevent chronic disease and manage chronic disease should it occur. We like to get an understanding of whether or not our patients smoke, because we know it can negatively impact their long-term health in a variety of ways. When a patient's new to our practice, one of the first questions we ask regards smoking status. So if a patient is a smoker, we find it really important to determine what they're smoking, how long they've been smoking, and if they've ever had the desire to quit before, or if they've actually tried to quit before. I think a lot of people understand the impact that smoking has on our lungs. Because it makes sense when we smoke cigarettes, nicotine and other chemicals get directly inhaled into our lungs. Nicotine specifically has a large negative impact on our lung health. It causes tissue inflammation. It damages the cells that line the lung tissue, and it damages the alveoli, which are like little air sacs within the lung that are important for gas exchange and helping us breathe. So people who smoke are at much higher risk for developing like a chronic lung disease, like chronic obstructive pulmonary disease, emphysema, and lung cancer, amongst other things. It also makes them more prone to negative outcomes from illnesses that we contract in the community pretty easily, like pneumonia, influenza, and COVID-19. So those smokers who end up with these, community acquired illnesses will oftentimes end up like in the hospital and really sick, whereas most other people might not even need treatment for it. They can just treat at home with like just symptomatic care. I'd also like to educate people that smoke anything about the impact that smoking has on other parts of their bodies besides the lungs, because some people aren't as aware of those effects. So a lot of data exists on the impact that smoking has on our cardiovascular health, which is the health of our heart and blood vessels. I see a lot of people trying to downplay the amount they're smoking, especially if they only smoke like a few or one cigarette per day. And there's some surprising statistics about the dangers of smoking even just like one cigarette a day. So according to UpToDate, which is a kind of like what we consider a point of care medical reference text that's really accessible for most healthcare providers and students when they need assistance with decision making, even just smoking one cigarette per day can increase your risk of a adverse cardiovascular event or disease by 50%, and the chances of having a stroke by 25% compared to people who smoke 0 cigarettes per day. The more a person smokes, the higher chance they are to suffer from a cardiovascular complication of smoking. Smoking puts a person at risk for the development of cerebrovascular disease, which would be pertaining mainly to the brain. So that's kind of like strokes and like brain aneurysms and things like that. Atherosclerotic heart disease, which primarily involves the heart, so that would be like heart attacks, peripheral vascular disease, so primarily impacting like the veins and arteries of the leg, or heart failure. Smoking can also impact other parts of our body that we don't necessarily even associate with our heart and lungs. According to the CDC, smoking can impact your dental health, bone health, and fertility in both men and women. Smoking during pregnancy can cause a whole host of complications for a developing fetus, and when that child is born, they'll probably have lifelong complications as a result of a parent that either smoked directly during pregnancy or someone who smoked around a pregnant woman while fetus was developing. Smoking also can make like type 2 diabetes significantly more difficult to treat, and it can contribute to the development of cataracts and rheumatoid arthritis, just to kind of name a few of the variety of health conditions that it can cause. Smoking also influences the health of non-smokers who are regularly exposed to cigarette smoke. I like to emphasize that there is no safe amount of secondhand smoke exposure at all. And the exposures to secondhand smoke will generally just compile over time to cause problems in the future. So secondhand smoke, interestingly enough, can have far different implications for the health of children versus adults. So in children, it can cause, unfortunately, sudden infant death syndrome, middle ear infections, upper and lower respiratory tract infections. And I see a lot of children of smokers who have asthma or poorly controlled allergies, dermatologic conditions, stuff like that. For adults, it can lead to stroke. So somebody who doesn't even smoke that spends a lot of time around a smoker could possibly have a stroke because of that exposure over time. It can contribute to coronary artery disease, nasal irritation, and it can cause like low birth weight for women who spend time around cigarette smokers during their pregnancy. So some non-smokers exposed to secondhand smoke will develop lung cancer or die earlier than anticipated, just based off of their repeated exposures to secondhand smoke over time. Smoking is directly linked to 90% of lung cancer diagnoses, which is a pretty high statistic. There's strong evidence and recommendation that there's a lot of benefit to screen for lung cancer. So we utilize a low-dose CT scan to screen for lung cancer. The screening at this point is only relevant for like cigarette, cigar, and pipe smokers, but I am fairly confident at some point that will change to include e-cigarette users as well. A lot of primary care providers follow guidelines from the United States Preventive Services Task Force to determine who to screen. So we screen anybody at this point in time, and this might change in the future, but currently we would screen anybody between the ages of 50 and 80 who are currently smoking, or those who have quit within the last 15 years and have a 20 pack year history. So pack year history is calculated by multiplying the number of years a person has smoked with the packs they smoked per day. I recently had a patient who agreed to do the screening after a few years of, just kind of gauging their interest and weren't interested, and I didn't want to be pushy, but this year they finally agreed to it. This person had a 40 pack year history. Her scan revealed lung cancer. So upon further workup, that included a lung biopsy and kind of like what we call a PET scan, which is like a full body scan to determine if someone's cancer has spread. Her cancer was caught early. It was confined to the lung, hadn't spread to the lymph system. She'll need radiation, but catching this cancer early will strongly increase her chances of remission or even cure from the cancer. So it's like a good example of why we really need to encourage our patients to do stuff like this. Quitting smoking can actually reduce the risk of cancer in approximately 20 to 90% of people who quit smoking will not develop cancer because they've quit. Many people who stop smoking also reduce their risk of other complications from smoking, like their chances of having a heart attack or stroke. The approach to quitting smoking is really individualized, and I like to ask, gauge the person's interest to see like, what do you think would be the best fit for you? So I present them with options. So I often like to have this conversation when the person is like very confident they're ready to quit. Some people who aren't ready will try to quit and they get frustrated because they can't, and then they just decide to start smoking again. We have to make sure people are ready. One of the most effective ways to quit smoking is cognitive behavioral therapy, because some people use smoking as a coping mechanism for some reason, or it's just such a regular part of their daily routine. They don't know what they do without it. So the counselors will work with individuals to identify why they're smoking and possibly to help them develop a healthier coping mechanism or change their routine up a little bit. We also utilize state of Michigan website. They actually have great resources to help with quitting smoking, like the To Michigan Tobacco Quit link. Many local agencies like the health department, they can offer support for quitting smoking. Some people prefer to use like support from the community plus like a nicotine replacement agent, such as patches, gums, or lozenges that are easily accessible over the counter to pharmacy. There are some like prescription options as well. That would require a trip to the primary care provider's office to kind of review proper utilization of the medication and counseling on side effects, how long to take it, stuff like that. Use of electronic cigarettes has really risen in popularity within the last several years, especially amongst younger people. So e-cigarettes use a battery to heat up a vapor, producing smoke. Some e-cigarette cartridges and we've touched a lot on this, but some contain nicotine, some contain THC, marijuana. The use of e-cigarettes is known as vaping. So I read a great article that came out last September in the Journal of the American Academy of PAs, which coined vaping as Gen Z's nicotine crisis. And a lot of information I will give you today on vaping from a health statistics standpoint comes from that article. So in 2011, approximately 1.5% of high school students, and this is a nationwide statistic, were using e-cigarettes. And in 2019, that exploded to like 27.5% of high school students reporting use of e-cigarettes. That article also referenced the statistics amongst middle schoolers, which in 2019, 10.5% of middle school students were using them, which is very high, considering you shouldn't be able to purchase them at that age. Popularity in e-cigarettes amongst adolescents and teens is largely influenced by product marketing. So there's been a lot of money put forth towards marketing these products amongst the companies that make them, specifically towards, adolescents, teens, young adults. Vaping companies kind of like to target like YouTube, Twitter, and social media platforms that are more commonly used by teen and adolescents to market them. The devices are also very sleek and discreet and appealing for people to carry around. And we have touched on this, but the flavored options are very appealing to some individuals as well. So that they kind of get excited when they see that, I can smoke something that tastes like raspberry, like that's cool. But there is definitely a false sense of safety when it comes to e-cigarettes versus traditional cigarettes. Many of the same risks still occur when we use an e-cigarette. So smoking anything can really increase your blood pressure or heart rate. And even if it's just vaping, it will produce the same effect just like a cigarette would. There is not a lot of data right now on the specific statistics regarding e-cigarette dangers, but there is so much evidence that's coming out about how people who vape will suffer the same cardiovascular and cerebrovascular consequences as a traditional cigarette smoker. In addition to that, e-cigarettes actually unlock a whole unique set of dangers for users because the battery involved generates so much heat that people can actually suffer from like chemical burns, explosive injuries, chemical injuries as well because of the e-cigarette cartridge. The liquid nicotine contained in vaping cartridges can also be harmful for people who accidentally ingest them. The article I referenced earlier said that calls to poison control about accidental ingestions from vaping cartridges is just, constantly increasing since 2011. Symptoms of like a accidental nicotine ingestion would range anywhere from just mild nausea and vomiting to death. This happens a lot in, unfortunately, very young children whose parents vape. They just get a hold of them and eat them, and then they have to make an emergency room visit or a call to poison control. There's actually a unique lung condition related to vaping called e-cigarette product use associated lung injury, or EVALI, and that contributed to 68 deaths in 2019. It was more commonly associated with vaping THC. And there's also a lot of question in regards to the implications of vaping in neurodevelopment. To keep young people safe from the dangers of e-cigarette use, the article I referenced cited parental support and monitoring, involvement in scheduled activities like extracurricular activities or work, and self-control amongst users as protective factors amongst vaping. Vaping is not regulated by the Food and Drug Administration, so a lot of effort is being made to increase on the regulation of these devices by the FDA, and some of that would include like taxing the products to make sure they're more expensive, trying to ban some of the aspects of the e-cigarettes that are really appealing to users. So that is all I have.
Oh, I wanted to interrupt you about 6 times because you made me think of some questions that came up. So I jotted a couple down that I wanted to ask you. When you're doing physicals for students, because some of the athletes need physicals when they, before they go back to school, and when you're doing your adolescent appointments, are you actually asking these students if they smoke?
Yeah, so we ask anybody over the age of 12 if they engage in any form of smoking. And at the end of our adolescent visits, we often provide parents with like anticipatory guidance. So a little, in addition to our counseling, the sheet they go home with also highlights some of the dangers of engaging in activities like smoking and using alcohol and other drugs.
Okay. Another question that came to me was, is there an amount of time that somebody would have had to have smoked? Like, let's just say they say, well, I smoked, but it was only 5 years when I was 15 to 20. Does that mean in the future they have a better chance of developing cancer? Is there any amount of time that somebody would have had to have smoked to increase their chance in the future?
Yeah, I think there is really, I like to tell everybody that there's no safe amount of cigarette use, because I haven't had a lot of the patients that I have seen, like my patients and colleagues that I work with, a lot of their patients who have smoked for a long period of time can have, most of them, those are the people that are more likely to develop lung cancer, but really and I would say, someone who's had maybe 2 cigarettes in their life, it's probably less likely that they would develop cancer. But for someone who has smoked for several consecutive years, even if it was just 1 cigarette a day, absolutely, I would be worried about their lung cancer risk. But technically, according to our screening guidelines, we wouldn't offer them a lung cancer screening because it wasn't like a long enough period of time where they don't have a pack year history, but I think it still could happen.
Yeah. Well, and I think what you said about your patient success story, screenings are very, very important. I can't say enough how important preventative services and preventative medicine is, to be able to identify and catch things early before they really progress and become more of a chronic disease or a chronic illness. That's all the more reason why people should be seeing their doctor.
Absolutely.
You don't wait to take your car in to get an oil change, right? You take it in when it's time for an oil change because you want it to last. But, people need to be as good to themselves as they are to their vehicles.
Absolutely. Yeah, in primary care, that is our entire goal, getting young people in early so we can help to educate them on the dangers of certain things and how even just doing something once can, cause a lifelong implication. So yes, can't stress enough the trips to the primary care provider and following the recommendations we give for preventive cancer screenings.
Thank you, Stephanie. Lots of information. You did a great job of trying to get all that in.
Yes, thank you so much.
If you're just joining us now, this is the UP Community Health Town Hall program, and tonight's topic is vaping, with just a touch on the smoking as well. And our next guest is Karen Brown. She is the Tobacco Dependence Treatment Coordinator for the Tobacco Prevention and Control Unit at the Michigan Department of Health and Human Services. So thank you for joining us tonight, Karen.
Hi, thank you.
Yeah, we're looking to you to put this in the state perspective for us now.
Sure.
So please take it away.
Yes, thank you for having me. I wish I were actually up there with you, but I'm down here in Lansing, Michigan. So a couple things I wanted to share from the Behavioral Risk Factor Survey in the state of Michigan in 2020. We had a rate of 3.7% of US adults who are currently using e-cigarettes. And among those adults users overall, 36.9% of them also currently smoke cigarettes. So they're dual users. 39.5% completely switched, and another 23.6% have never smoked cigarettes, which is concerning, that they're picking up this other habit, which is not good for their lung health. We've seen that, and we've heard a lot of statistics already about youth cigarette smoking, so I'm not going to go into that so much. But in 2019, with the Youth Behavioral Risk Factor Survey, we saw a shocking 50% of teens responding to that survey in Michigan saying they used e-cigarettes. 49% of youth in that survey said that they wanted to quit, and 26% tried to quit in 2021. So it's good that there is an interest in quitting once they start and in trying to quit, but then we're seeing also how many youth are having trouble. So we have some programs that can help with that. Some have already been mentioned here, but I'll go into further details. One of the things that we do at the state, a lot of people mentioned previously that a lot of kids think this is water vapor, and even some adults think that this is water vapor. So I really educate them. It's not water vapor. It is an aerosol. It is an aerosol like hairspray, like Febreze. It has particulates in it. They are landing on your clothes just like particulates would off of the smoke from a cigarette. So it's having secondhand particulates from e-cigarettes in the air. It's also having what we call third-hand exposure, where it's landing somewhere on a couch and it just sticks there. So I generally also tend to call it e-cigarettes rather than vapes, just to try to get away from that perception that it's a water vapor, because it just isn't. And the e-cigarette companies are really trying to push that term because it makes it sound cool and friendly, and something kids would want to do. But we do have some great resources. I'll go over some of those now. I think one thing has been mentioned was the Michigan Tobacco Quit Link. It was formerly known as the Michigan Tobacco Quit Line. This actually began in 2003 in the Upper Peninsula and was limited to people who lived in the UP until 2004, when we expanded to the rest of the state. The Michigan Tobacco Quit Link offers treatment for commercial cigarettes, for spit tobacco, for e-cigarettes, and for other kinds of tobacco. We can cover it all for people. We changed our name from the Quit Line to the Quit Link because we really wanted to better articulate what it is that this program does. When you think of a quit line, you think of phones, you think of hotlines and things like that. And that's not what this is. This is a phone coaching program with multiple calls. We do use cognitive behavioral therapy and talking to our patients about quitting. We also use motivational interviewing. But for people who don't like the phone, especially like we're talking, younger people, maybe they don't want to be on the phone. They might be more comfortable doing something on a web service. So we offer online coaching now too. So you can do that live with a coach, the same program, just online. We also have programs where you could do either a standalone or in addition to any of these other programs, text or email messages. So these are motivational messages built around a person's quit date. And there are even some things in there, messages in there where you can text back to the quit link that, hey, I need more help or I need more information, and that can generate a call back to you or a message back to you. We also have some special programs I always like to highlight. For people who have either a substance use disorder or a mental health diagnosis, we have a program that helps people with the quit link with those disorders. It's a longer program. So in our general program, we give 4 coaching calls around a quit date. But for behavioral health, we do 7 calls. And we do that because for people with those conditions, they need a little more time to plan out when they're going to quit, to talk about what their triggers might be and how they're going to respond. And we do a lot more motivational work to get them to a quit date. So we don't start a quit date on that first call because that could be a bit daunting when they have these other challenges. So that's one program.
I want
Yes.
to ask you a question about that, about the
Yes.
quit part, because I'm just curious. If somebody is trying to quit smoking, is the theory, okay, if you're going to quit, start tomorrow and you quit, period? Or is it more of a, I smoke a pack a day, so, I'm going to start weaning off of that to the point where I'm down to 5 cigarettes a day? Or, what's the best way to move forward on that?
Well, that really depends on the person. Cutting back can be one thing, but they still need to, for instance, if they're going to cut back for, say, 3 weeks, they cut back for 3 weeks or 4 weeks, and then they look for an actual quit date. So we're still trying to get them to that quit date. Just like our previous presenter said, even 1 cigarette a day or 5 cigarettes a day can cause harm. So at some point, we want to see them get from that cutback to an actual quit day. But that is one way that people can quit. Another way is it actually, some of the nicotine replacement therapy packages are relabeled now, and you could start using those before you even start quitting. That is actually safe. It's been done for many years in the public, and now the FDA has said that yes. So if you look at the back of a package of those things, of those products now, you'll see that you could actually start that early. So for somebody who really, really has a hard time quitting and maybe is smoking 2 or more packs a day, that might be also something they want to try. So it makes it a little less daunting. Some of the other programs we have an American Indian program, and that is actually staffed by people by American Indians. So it's by American Indians, it's for American Indians. That also has a longer coaching protocol, and really talks more about the difference between traditional tobacco that is used in the community and the commercial tobacco, which is more of the addictive substance that they're trying to get off. We have a special prenatal program, and that really works with women who are there's a lot more shame and guilt around smoking while pregnant, and we really want to try to remove that stigma. So we have specially trained coaches who stick with them for the whole program, and work with them on how to quit. We also do lung cancer screening on the quit link now. So if you're in that age range, we will do a lung cancer screening assessment. And then we will send them to an educational tool, which includes a video to try to demystify lung cancer screening and make it a little less scary. And we also send them some information and a decision tool that they can bring to their doctor's office to have a discussion about getting scheduled for lung cancer screening. We also have a program for youth who are using e-cigarettes. And that is called My Life, My Quit. And they can actually visit that program online and enroll. There's also a whole lot of information on there. We find a lot of youth in Michigan are visiting that site, and they may not enroll, but they're clicking through a lot of our information. So they're learning, and youth tend not to engage as heavily in these programs as adults. So we're still excited that we're seeing that learning taking place. So if you just go out online and search for My Life, My Quit Michigan, that will show up. And you had a question?
Yeah, I was just going to ask you, I know we've only got a few minutes left,
Yes.
but I was hoping you could talk for just a moment about some of the legislative efforts right now around vaping. I think we talked about at least 5 bills right now.
There's no bills right now.
Okay.
there has been talk about some bills.
Okay.
So I really, for parents and schools and other people who are really interested in this topic, I would like to point you to an organization. Again, you can Google this, Tobacco Free Michigan. So if you Google Tobacco Free Michigan, you can join with them, you can get their emails, you can see what they're working on, because they are talking about some legislative efforts. One of the things that is interesting here in the state of Michigan is that your counties, all our counties and our cities are prohibited from enacting any kind of law that is stronger than state law when it comes to tobacco. So tobacco stores, things like that. So that's something that Tobacco Free Michigan is looking at. So that's something you can get more information about. And also the Campaign for Tobacco Free Kids. That's another site that that also has rich information about e-cigarette use with kids. And also they do some legislative efforts, both in states across the country and federal legislation.
Yeah, I think it's really important for people to understand the role that they can play in legislation. And so often it's really, capturing stories and being able to effectively talk about, what's happening on the ground and putting it in perspective for, our senators and people who are making the laws and the bills.
Right. And Tobacco Free Michigan has a lot of tools. They have sample letters that people can use. So parents, kids, we encourage kids to get involved with that too if they're interested. It's a great thing to bring up as the school year starts, as a project kids might want to get involved in. I know there's some efforts going forth to try to have a youth coalition in the state. We do not have one right now. So yes, I very much encourage youth who are interested in getting involved and speaking up to go to Tobacco Free Michigan and check out that source. They're very welcome there.
Thank you, Karen. This has been great information.
Sure.
Couple things I just want to hit on for some of our listeners. There were statistics tonight given from communities that care. I kind of want to show everybody, this is the UP Community Health Needs Assessment that was conducted in 2021 for the Upper Peninsula. It's about 450 pages long, but it has a lot of data in here and it's broken out by counties. A lot of us in the industry will use that information for writing grants, but it's great to go online and find this at the Western UP Health Department and to be able to take a look at what's happening in your community. Consider getting engaged in your communities that care. I'd like to thank tonight's guests, Sawyer Riefeld, Stephanie McKenzie, Ashley Gleason, and Karen Brown. Thank you for joining tonight. We are going to be adding a quiz to tonight's program and posting that on our website. So we will be sending this link out to faculty and to teachers throughout the Upper Peninsula and encouraging them to assign some of our video recordings and quizzes to their students to help spread the word and get this information out. So thanks again for joining tonight. And this program will be available on nmu.edu/rural health. So thank you.